The Human Rights Watch organization came to Alabama when they realized that our cervical cancer mortality was the #1 in the nation. Our rates of cervical cancer mortality in some counties mirror that of developing nations, where they don't even have access to PAPs or vaccination to prevent it. And this is despite the fact that women are getting Pap smears at the same rate in Alabama that they do in the rest of the country. So there's got to be more to it. There's a lot of different factors that we are looking at. There's obviously vaccination rates to prevent it, but vaccination rates are never going to affect that generation of women who were too old to be vaccinated, who are now in their late 30s, early 40s, and on up, and remain at risk for cervical cancer throughout their life. And we know these women are getting PAPs, but unfortunately too often they're not following up on those abnormal PAPs. And the Human Rights Watch came to shed light on these women's stories to talk about the lived experience of cervical cancer in Alabama. The report is incredibly disheartening to think that there are women less than 100 miles from where we're sitting right now who are dying of a preventable illness in the shadows of a cancer center and an organization that could provide all the treatment that they need. Those women's stories talk about barriers to care that are across the gamut, everything from family life and being busy and life getting in the way, all the way to having difficulty getting in for the care that they needed and not having the insurance that they knew even seeking medical care would put their family into debt. There's a lot of things that we are looking at to try and make an impact. The rates in cervical cancer in Alabama are terrible, but oral pharynx cancer in men outnumbers cervical cancer in women. So we've got to work on HPV-related cancers in men and women, boys and girls. So we start by vaccinating our adolescents on time and get all the shots in by age 13. Second, we look to the moms and dads and make sure that women are getting their Pap screenings on time, but more importantly, know the access that they have for good follow-up care. Women who are uninsured or underinsured in Alabama have access to free Pap test, diagnostic testing, and insurance coverage for treatment. So we can take care of any woman who presents with this problem. So January is Cervical Cancer Awareness Month, and we are really excited. This is our second annual Go Teal and White campaign. This year we're doing a statewide campaign with participation from the Laurel Crandall Brown Foundation and the Lilies of the Valley, in addition to our American Cancer Society and Department of Public Health partners. So we think it's going to be a great campaign to really get the word out to prevent cervical cancer by vaccination, PAPs, and follow-up testing.